When it comes to the vitamin alphabet, we all know the heavy hitters, A, B, C, and D. But usually, by the time people get to the letter E, they completely lose interest. However, there is one crucial vitamin sitting further down the alphabet that you absolutely should not overlook. It's vitamin K. Found in green leafy vegetables, grains, and even some cheeses, vitamin K is an unsung hero. It is vital for scores of bodily functions, from wound healing and bone regeneration to keeping your blood pressure in check. Let's dive into why this forgotten vitamin is a game changer for your health. One of vitamin K's most incredible superpowers is how it manages calcium in your body. It prevents calcium from being deposited on the walls of your arteries and major blood vessels. This reduces vascular stiffness and keeps your blood flowing smoothly, effectively lowering blood pressure and reducing the risk of heart attacks and strokes. But it doesn't just throw that calcium away. As Professor Jan Olav Asev explains, vitamin K carries that calcium directly away from your heart and deposits it straight into your bones. This makes vitamin K doubly useful. It simultaneously clears your arteries and strengthens your skeleton. The benefits don't stop at the heart and bones. Recent studies have positioned vitamin K as a powerful tool to stave off dementia. According to pharmaceutical expert Professor Penny Ward, vitamin K helps preserve normal brain function by preventing brain cell death and clearing toxic amyloid proteins from the brain. In fact, diets rich in vitamin K, like the famous MIND diet, are heavily linked to cognitive preservation. A major study tracking over 900 participants found that those who strictly followed their care on Musk's brain-focused diet reduced their risk of Alzheimer's disease by an astonishing 53%. Furthermore, adults eating a diet rich in vitamin K tend to live longer overall. General health benefits include a significant reduction in inflammatory proteins and an improvement in insulin sensitivity. This means getting enough vitamin K may also actively reduce your risk of developing type 2 diabetes. But what exactly is vitamin K, and how do you get it? Vitamin K is a fat-soluble vitamin that actually exists in two forms, K1 and K2. They do slightly different things. Vitamin K1 primarily targets blood clotting, and you can find it in leafy greens like Brussels sprouts, broccoli, asparagus, and spinach. Vitamin K2, on the other hand, is the star when it comes to directing calcium away from arteries. You can get K2 from fermented foods, chicken, eggs, and dairy products like full-fat milk, yogurt, and cheeses like Gouda and Brie. The problem with modern diets is that we simply aren't eating enough of these foods to get the daily requirement, which is roughly 1 microgram per kilogram of body weight. So should you rush to buy supplements? While they are cheap, experts agree there is generally no need. You can easily get what you need from a balanced diet. However, a crucial warning: if you are on blood-thinning medications like warfarin, do not suddenly increase your vitamin K intake or take supplements without consulting your doctor. Warfarin specifically blocks the body's use of this vitamin to prevent clots, and sudden dietary changes can cause dangerous interactions. For everyone else, it's time to put those leafy greens and cheeses back on the menu to protect your heart, bones, and brain.